Hello, dear doctors, nurses, medical students, and healthcare team. How are you today? I hope you are well. Here we are going to talk about another question about cardiology. A 46-year-old man with a history of a myocardial infarction complains of chest pain with shortness of breath on exertion over the past few days. ECG was shown to be normal. Echocardiogram shows decreased ejection fraction and decreased septal wall thickness. What is the single most likely diagnosis? A. Dilated cardiomyopathy. B. Constrictive pericarditis. C. Amyloidosis. D. Subacute endocarditis. And E. Pericarditis. According to the patient history and sign and symptoms, the diagnosis here is dilated cardiomyopathy, and we are going to explain it. Okay, explanation. Although in many cases no cause is apparent, dilated cardiomyopathy is probably the result of damage to the myocardium. In this case, it was due to the fibrous change of the myocardium from a previous myocardial infarction, as we can see in the patient's history. This is supported by the decreased ejection fraction and thinning of the septal walls seen on the patient's echocardiogram. Dilated cardiomyopathy is a disorder of the heart muscle characterized by left ventricular and right ventricular dilation and impairment of systolic function, as we can see in the patient's echocardiogram. The presentation of dilated cardiomyopathy it presents as congestive heart failure like dyspnea, edema, rise, GVP, pulmonary congestion, and cardiomegaly. The management according to the patient's size and symptoms would be therapeutic with drugs, antihypertensive, antiarrhythmic. It's related to the patient's conditions, or if it's progress, the surgical intervention will solve the problem. Thank you.